So you might already be familiar with the LMB dynamic extension splint that's used for PIP joint flexion contractures. So the goal of the splint is to try and increase the extension at the PIP joint by providing a dynamic stretch to the joint. You want to place the center of the splint slightly proximal to the PIP joint so that it doesn't cause pressure areas. You can adjust the tension of the splint by squeezing the legs together to make it slightly looser, or stretching them further apart to increase the stretch on the joint. In my experience, these work well for stubborn contractures, particularly if the contracture is less than about 30 degrees. But for some joints that are a little bit more grumpy and tend to swell when we use these or become inflamed, the Capener is also a really lovely alternative. It's got this coil design on the side to provide that 3-point pressure. And it's just giving slightly lighter pressure, but still holding that PIP joint in its end available range. It's usually better tolerated by clients overnight for sustained low load prolonged stretch. The benefit of this design as well is because that coil is quite light, the client can actually flex against the splint, and when they relax, it's just bringing the PIP joint back into its maximum extension. There's a long and a short version. The long version has a slightly longer trough, so it's providing just a slightly bigger area of force distribution, which again can relieve the pressure somewhat and be more effective for the more stubborn contracture, making it better tolerated. It's also good if you've got a bit of a contracture developing at the DIP joint. So to measure these splints, all you do is measure the circumference at the PIP joint of the affected finger. And that corresponds with the size of the splint, again in extra small, small, medium, large and extra large. There's no left or right.